Surgery, a competency-based companion, is designed to be just that, a companion for medical students and residents, a companion whose sole purpose is to teach you to think like a surgeon. It was designed to break the mold of the average student-resident textbook. The case-based format encourages active learning and demonstrates how to apply theoretical constructs to surgical practice. Every one of the 53 case-based chapters embeds the 6 competencies set forth by the Accreditation Council for Graduate Medical Education and teaches the student how to think about many different aspects of inpatient and outpatient problems seen on a surgical rotation. Each case-based chapter begins with a differential diagnosis, followed immediately by speaking intelligently, which shows concisely how to sort through the differential diagnosis. Patient care begins with key points of clinical thinking, and then demonstrates the essentials of the history, physical exam, lab tests, and imaging considerations. Actual prices for lab and imaging tests make the student mindful of cost, a principle of systems-based practice. For each entity mentioned in the differential diagnosis, there is a medical knowledge clinical entity box where the following elements are considered for each diagnosis: pathophysiology, typical patient presentation, how to make the diagnosis, and the basics of treatment. In the book's online version, accessible by using the passcode inside the front cover, each clinical entity box is hot-linked to appropriate passages in Sabiston's Textbook of Surgery and Becker's Essentials of Surgery, so with a mouse click the student can consult more in-depth knowledge of any subject. The zebra zone highlights low-frequency diagnoses, but by being in a separate zone reminds the student that common things are common and one should think of horses, not zebras, when hoofbeats are heard. The practice-based learning and improvement competency is demonstrated in 2 different ways. Some chapters demonstrate the importance of evidence-based surgery with classic examples from the surgical literature. In other chapters, the importance of improving one's practice by analysis of one's complications is modeled by examples of morbidity and mortality self-assessment forms completed by experienced surgeons. In each chapter, paragraphs on interpersonal and communication skills and professionalism discuss issues of professional behavior pertinent to the clinical context. And systems-based practice explores how each case fits within the larger context of the healthcare system. Surgery, a competency-based companion, is filled with special features that add depth to surgical learning. The art of oral presentation teaches how to present a case in 3 different contexts: the middle of the night call, morning work rounds, and teaching rounds. An ICU flow sheet simplifies the complexities of critical care. It demonstrates how a student might read and report ICU data and juxtaposes student observation with chief resident interpretation of the same data. This gives students a clear model of how to integrate and synthesize. At the conclusion of the critical care section, there are 3 sophisticated examples by critical care experts demonstrating how the student or resident should analyze critical care cases, prioritize properly, and integrate care. 37 of the most common general surgery operations have been reduced to a single page, providing a concise guide that prepares the student for operating room participation and understanding. 5 teaching visuals engage the student in mastering some of the most challenging concepts in surgery, so they can understand these issues more clearly and give explanations to their patients by drawing appropriate diagrams. Professor's Pearls. At the end of each section, see how noted experts answer clinical review questions. The book's value rests not just on its unique competency-based approach, but on its numerous contributors, a who's who of expertise in surgical education. On the book's website, the student or instructor can sort all of the writings by competency: interpersonal and communication skills, professionalism, or the systems-based competency, creating a virtual mini-curriculum, a vertical read of each competency as it pertains to surgery. The competency-based self-evaluation form promotes self-reflection. This form may be downloaded as a Word document to enable the student or resident to evaluate their patient care. Students and residents can accumulate their own competency self-assessment portfolios. Clerkship directors and program directors can track competency awareness and improvement. Surgery, a competency-based companion, is the only textbook that teaches med students and residents how the 6 ACGME competencies are related to the practice of surgery. This book demystifies the complex nature of surgical thinking and brings medical education into the 21st century. Surgery, a competency-based companion, is the first in a series. Upcoming titles include obstetrics and gynecology, medicine, and pediatrics.